Hello, 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 everyone. Welcome, welcome. I see the virtual attendees are slowly coming through. Welcome all. So nice to have you here today. My name is Kevin Shaw. I am the Executive Director of the Eidos LGBTQ Health Initiative. And I'm so excited to have you today for our conversation, panel discussion on community care and LGBTQ health. As you're all settling in, I'm going to go ahead and share my screen. I want to start out by telling you a little bit about Eidos and our work, and a little bit more about the topic that brings us together today. So before I introduce you to our lovely panelists, let me tell you a little bit about Eidos. Now, we are new kids on the block, just about a year and a half old. Eidos was founded with a specific attention on convening and connecting people from across sectors to engage in some of the most lingering health disparities for LGBTQ plus people. It is our belief that no organization, no group has a monopoly on good ideas or best practices. And so we try to engage with folks from all across sectors, from business, healthcare, policy, community, who are doing great work so we can get solutions out as quickly as possible, and we can make solutions that solve problems that are persistent for people in need. Now, of course, we do focus on LGBTQ health disparities because even with all the progress made in past decades, we still see lingering effects of health disparities in these populations. Now, even if you look at us as the most conservative way possible, just 7.2% of the population, we know that in every generation that has found it safe and secure to come out, more and more people have. And if we don't solve these issues now, the problem will literally just grow. And I'm not just talking about sexual health. This is often we get pigeonholed with this topic, but remembering people that there are health disparities for queer folks from cancer, cardiovascular disease, across different spaces. And so we are trying to get solutions to these people because we know that there is a system that is not designed for us. The reason these disparities linger is that there's a system of challenges that people must face, right? From social determinants of health, whether you have a job, whether that job comes with benefits, what things will be included on your benefits package if you have it. All of these questions must be answered and contribute so much to our health, but we don't always discuss them. Understanding that there is this entire network around us contributing to our health is central to what we do at Eidos. And what we try to do in conversations like this one is to see how we can look at one issue from multiple points of view, again, to get the best work out there. So the issue we're talking about today is the effects of loneliness. And really, this is something that the Surgeon General of the United States sounded the report on last year with a report on epidemic of loneliness and isolation. Right? We know that there are measurable, concrete health effects from not having a robust social network. So whether this shows up for you in your work as lack of belonging, social disconnection, isolation, we know it affects the body. In some ways, more than smoking 15 cigarettes a day, which is just a crazy fact for me as a child raised in the 80s and 90s. I think there's something worse than smoking out there. So today we invite our panelists to kind of talk about this from different points of view and talk specifically about how could something like community care, mobilizing a group of people to look at this question of loneliness, lead to better outcomes, especially for queer folks who we know are more likely to suffer from the effects of loneliness. So since we'll be talking about community care a lot today, I want to give you a simple definition that we'll be working from. Kind of at its simplest level, community care are approaches to health where the community supports an individual's health instead of the other way around. So often we focus on what the individual is supposed to be doing for themselves. But remember, we are fortunate enough to be part of a community who can support us. So anything that kind of supports individuals within your group, that is community care. And the reason it shows up so much in queer work is that the origins of community care, even though it's kind of a buzzword now, goes back to any underserved community, right? In any group of people who have been forced to come up with their own solutions and to face problems on their own, they have been creative, they have been industrious, they have come up with things, all right? So community care is something that's been going on for a long time. We by no means invented it today just for this talk. And the other thing I'll mention is self-care is something that people talk about a lot today. We are not anti-self-care at Eidos. We very much support self-care, but it's sometimes become the only tool in the toolbox, it feels. And if we understand that what's making us sick is part of a system, the onus for solving that can't be on the one person to take care for themselves. So as we talk about community care, don't forget about self-care, but maybe put that to the side for a second. So some examples of community care that you might be already familiar with are mutual aid societies that raise money within a community and redistribute it to projects and people throughout that community. Peer support networks are another long-standing example of a community care project where you create chance to develop strong relationships, mentorships, partnerships, things to advance people who are in the same sort of boat as you are. And I put food pantries here. Maybe a better way to think of this would be like a community fridge. I live in West Philadelphia, which many a block you'll find a refrigerator outside of a house with an Instagram account. And when that fridge is empty, they put a call to Instagram. Within a few hours, that fridge is full. So it's food for the community, from the community. So these would kind of be all kind of classic examples of community care programs. But how can community care address isolation and health, right? We're here to talk about sort of belonging and connection and how that can support people's health. Well, the Surgeon General was kind enough to give us some ways of thinking about this along with the report, reminding us that every individual exists with personal relationships, community connections as part of the wider society. And so really anywhere you find people, there are opportunities to build in opportunities for connection. So for example, if you have an outdoor space as part of your organization or just in your neighborhood, right? Are there gardening programs to get people who love plants together? Are there meetups there to let people from the neighboring area kind of meet one another? In schools, yes, obviously they're to learn, but are there supportive and diverse clubs so that any student can find a student like them who has a similar interest and kind of build their network? In the workplace, right? How do we acknowledge important events for our staff so they know that we see them, include them, and support them, right? And of course, what brings us here today, healthcare, right? How can we support patients just beyond the medicine and medication that we give them, right? What if there were programs to support not just the patients, but their caregivers, right? Make sure that their whole network was feeling supported and robust. What if there were programs for peers experiencing the same health issues to talk to one another and compare notes? And what if the programming we provided wasn't just about how to take your meds or treatment plans, but about relaxation, joy, and affirmation, so people had a chance to connect on these things as well? Now, I will let the experts speak to these things, but I always never like to lead with a problem without thinking what you could do about it. So just real quick, I kind of divided these into micro level and macro level things to do if you want to engage in this work. You know, just cooking a meal for a friend, checking in on someone you haven't seen in a while. If you're feeling really nice, offer to take care of a child or a pet. That is if someone volunteered that for me, I'd be quite pleased. Are ways of checking in, caring for people around you, providing your support to people around you. At a macro level, of course, if you are from an organization that does some of this work, creating volunteer opportunities that really are about forming connections, getting people to talk and interact with one another. If you're in a workplace and you see an issue, gathering people around you to kind of solve that, creating an action group, being the change, which I know that is work, that's why it's macro level, but just to say, you could think about that. And of course, if you are from a policy organization, advocating for inclusive policies where you work and where you live. All right, all ways that you can engage with sort of community care for connection. But like I said, don't take my word for it. I would love to hear from the real experts. So in just a moment, I will turn off my camera, but let me tell you about who you'll be meeting today. Our moderator is Jessica Hallam, the Senior Director here at Eidos LGBTQ Health Initiative. She'll be talking and posing questions to our panelists, Audrey Davis, the Senior Director of Health Equity at Cancer Support Community, Andre Ford, the Executive Director of the Colors Organization here in Philadelphia, and Luna Gayeski, the Program Manager of Peer Support Programs at Plume Health. So with that, I'm going to stop sharing my screen, invite the panelists to come on. I'm going to hide in the background for a little while and let Jessica take it away.
Kevin, once again, cheers to you. That was such even though I have reviewed those slides, I learned so much from you today. And I just want to thank you on a micro and macro level for being such an incredible member of our community here at Eidos and teaching me so much and bringing that incredible slide deck together. I'm going to be your supervisor for a second and implore you to write those remarks up. I'd like to publish that as a blog post. I thought that was just the most wonderful remarks. Am I right? I mean, I just learned and you pulled it all together. You know, there's so much that we all have to offer. And I just don't want to lose that. That was wonderful, Kevin. Thank you. So I want to start off today. We've got a wonderful audience with us today. I know many of you are here because you are in nonprofits, you're in healthcare, you're in small businesses or startups. We'd love to know where you're calling in from. Drop a note in the chat if you are comfortable introducing yourself and telling us where you are right now. It can be your work from home location or where your group is located, but we'd love to get to know you, see where you're from, get to know each other in the chat. I am Jessica Hallam. I get the pleasure of getting to have this conversation in big and small ways every day. I'll share a little bit about my background. I'm not a clinician. I do come to LGBTQ health work as a community care person. My first big part of this is many, many years ago in Chicago, Illinois. I ran a small nonprofit called the Lesbian Community Cancer Project. And that is where I first got to know Gilda's Club that Audrey represents today. And so there in Chicago, the Lesbian Community Cancer Project was a part of a national movement of lesbian and feminist cancer organizations that were purely volunteer run. It was tons of volunteers, tons of buddy programs, support groups. I came in and we raised money to pay our facilitators and buy food and decorate the office. It was a really magical time. So I just absolutely love this conversation. So a little bit about me. I'd love to, what I'm going to ask each of our panelists to do is to introduce themselves, talk about their organization that they work at, what brought them to this work. So it's sort of a little bit about where you work, the group that you are representing today, but also just your own personal, professional journey that got you into this. There's so much to learn from each of you. So let's start off with introductions. Audrey, would you like to go first?
Sure thing. Thanks, Kevin and Jessica. Hi, everyone. My name is Audrey Davis, pronouns she, her, hers. I am Senior Director of Health Equity at the Cancer Support Community. CSC, as I'll call it hereafter, is the largest professionally led nonprofit that exists, offering 100% free psychosocial support services to both patients and their loved ones who are along the cancer care continuum. We operate in 50 markets, have 190 network partner and affiliate locations globally. And depending on where you're located, you'll either see signs for Gilda's Club or Cancer Support Community, but we are all the same thing. I'm really proud of the work that we do to engage a variety of communities, including our LGBTQ plus cancer patients and their loved ones, and excited to be here to chat with you all today. I got into this field actually halfway serendipitously and halfway just as a result of life experience. When I got out of undergrad, I was certain that I was going to become a corporate attorney. I was in law school and I landed a summer associateship, actually my first summer of law school. So as a 1L, I landed a summer associateship, which was kind of a big deal. Was here in Philadelphia. And if anyone is familiar with the Clothespin Building, that's where I was a summer associate, summer for short. And I would take lunch when I had the opportunity to actually eat lunch and walk around Suburban Station and the Center City area. And I saw a lot of unhoused people. And I remember thinking to myself, I want to help these people. And I don't think I'm going to do that by working on a $3 million merger or a contract. It just didn't seem to connect. And so my heart was in one place. My career plans were in another. Also in the background, my dad, who had been diagnosed with stage 4 colorectal cancer when I was a senior in undergrad, was not doing so well and preparing to enter hospice. And so I took a leave from law school during my 2L year. My dad did fairly quickly after entering hospice pass away. And through that process and through that part of his life, I got to think about my own legacy and what I would want to leave behind one day when I was on my own deathbed talking to my family and loved ones. And I ultimately made the decision to leave law school, pursue a degree in clinical psychology. I thought I was going to help people one-on-one, but back to micro and macro, I actually ended up working much better in administration and on the macro level to affect change. You can't really help folks focus on how to cope with their depression if they don't know where their next meal is coming from. It's hard to tell a cancer patient, oh, just focus on your community when they're concerned about transportation and childcare, et cetera. And so that is how I got into this field. Again, I just feel very humbled to be here today to chat with you all. And I am going to pass it back to Jessica.
I loved that you talked about your own career in terms of micro and macro. That was a wonderful way to do it, Audrey. Luna, please introduce yourself. Let everyone know about your wonderful work.
Hi, thanks so much, Jessica, and thanks, Audrey. This is really an honor to be here, and thanks everyone who came and made us a part of their Wednesday. I'm Luna Gayeski. I'm here in West Philadelphia as well. I work for Plume, which is a health tech startup with the mission of transforming healthcare for every trans life. And we do that through providing both clinical care as well as community and wellness programming, including peer support groups and events and some other services. My journey to the mission of connection began with disconnection. I'm wondering how many people in attendance had some experience or identity that they felt they couldn't connect with adults or peers over in their youth. I thought I would maybe be able to see head nods, but I'm just going to visualize heads nodding. That's a relatable experience. For me, that sense of disconnection and isolation became defining and snowballed into a drug addiction. Many people have seen the viral TED Talk about Rat Park. If you haven't, I could talk about it in the breakout room later. But it essentially argues that the opposite of addiction is connection. And to make a long story short, for me, it was the grassroots peer support of other LGBTQ people in recovery who showed me another way of life, who had been building a sober community in the Philadelphia's neighborhood for decades and doing so without big money or some of the stuff we're having increasing access to now. It was these peers who helped me get established in a healthy sobriety that I've gotten to enjoy for the past 8 years. I took this newfound experiential understanding of the power of connection, of human relationships, of community, and I knew I wanted to dedicate my life to it. This led me to the study of behavioral health counseling at Drexel University, after which I worked as a medical case manager in HIV care here at Mazzoni, for those familiar. A time from which many stories could be told and many lessons were learned. After hours in that position, I would facilitate a non-binary peer support group for Plume, which I've already told you a little bit about. And after doing that for over a year, I had the privilege of stepping into this role to manage the program, grow the team, and scale the project.
Thank you so much for sharing that, Luna. What a wonderful example of disconnection and then connection, and how you've taken your own experience and turned it into something really, really positive and powerful. So we are so lucky to have you here. Andre Ford, you're up next. Please let this great crowd know all about you.
Hi, everyone. Hate this part. This is the part I hate. Andre Ford. I'm the executive. I go with the executive administrator for the Colors organization. Same thing as executive director. The Colors organization has been around since 1991. It was founded by Philadelphia performing artists, people of color, who was concerned that in the 90s that the African American community, their peers were getting HIV and dying from AIDS. And they wanted to do something that would help to raise awareness to their peers on what HIV was and what the information regarding it was happening. So they created a magazine called The Colors. And from there, they grew to not only do magazines, but talk about personal connections and stuff like that. Over the last 30 plus years, we've grown to not do magazines any longer, but do things like social media, a safe space that young people can come to and just feel comfortable being. Do a lot beyond HIV, holistic wellness, other STIs, educating everyone on those processes. Now, getting me here, I always joke about it because I'm a part of the Center for AIDS Research at the University of Penn. I am on the national boards for Center for AIDS Research, as well as other clinical trials, HIV cure research, all these factors, as well as I'm a lecturer at the University of Penn on nonprofit management. I used the story that I was brought in here by, told to come in, be a part of Colors to do an assessment for 6 months. Give them what they need, give advice and say what they need. It's been 6 years now. So I'm gonna leave it like that.
That is, I bet we all have a story of, oh, we thought this was just going to be a short gig and something pulls us back in, right? You know,
Yes.
it's a place, it clicks. And that's a beautiful example. I love that. And thank you for all your many years and Colors for all their great work in HIV care. Many of us come to this through HIV work, which is the perfect example, right? The beginningness of when I learned about community care was through the ACT UP and AIDS movement. I'm a little bit young for it, but really learning about what Kevin described, this micro and macro, the political and the personal, right? We can think about it around how our work and other issues, but there's such a wonderful example, right, in HIV around that personal and political. So before we get a little bit, we're going to talk about, you know, sort of the impact of community. There's a lot of people on this call that would like to learn. You know, one of the takeaways I want to have today is like, what are some learnings, some golden nuggets about how to do community well, how to build community, the lessons of community. But before I get to those positive takeaways, I do want to spend time diving into this issue of loneliness and isolation. We're hearing a lot about it, and someone just sent me another email this morning about, you know, another research on loneliness. But I guess I'm curious how each of you sees it manifesting, coming up in your, either with the people that you're serving in the work that you do. Has it always been, you know, it's sort of, is it the new buzzword? Or is it really naming something that we couldn't describe well before and helps us sort of discuss what's bringing us all together? So thinking about the folks that you serve and the issues of loneliness and isolation, how is it manifesting? What do we need to know? You know, let's pretend we've got a microphone right now, a megaphone, and we're telling all the powers that be about the role of isolation and loneliness in your community's life. How is it coming up? Audrey?
Sure. So to answer part of your question, I don't think that loneliness or disconnection is new. I think that with the recent pandemic, we're paying more attention to it in the general population. And so historically, marginalized, disenfranchised communities are now getting even more attention to their specific experiences of what loneliness and disconnection look like. You know, for LGBTQ plus cancer patients in particular, there are additional layers of stigma that present, especially if we consider not only cultural, but also geographic background as part of the calculus. For example, Black and multiracial patients, they are more likely to experience challenges not only during their diagnosis initially in care, but also treatment, but they also have additional difficulty with accessing culturally competent care. And so there's that additional sense of disconnection from their provider. Maybe it is a site that is supposed to be LGBTQ plus welcoming, but they don't have any people of color there, right? Or they don't have folks who maybe can identify with the experiences that are being presented. And so I think our programs at our network partner locations have done a phenomenal job of addressing this disconnection, but I won't get into that now. I'll save that for later. I will say I don't think loneliness and disconnection are new. I just think that now that other folks, and I'll leave that open to interpretation, other folks are experiencing and have experienced it more in the last few years, it's suddenly a big deal.
I love what you said, because you're putting words in my mouth, which is come learn from those of us who've been doing this work for a long time. Welcome to the party. There's a lot you can learn. But Audrey, you really raised about that multiple layers of disconnection. So it's interesting. You're making me think about disconnection, not just as a one point, but how we create layers of it, and how can we start to solve some of those layers, knowing that they won't all be gone, but how can we make sure we're not adding additional burdens to those disconnections? Luna, thoughts about loneliness and disconnection?
Yeah, I mean, particularly in our community, many people hold their LGBTQ identities as core parts of who they are and how they see and interact with the world. And so when the people around them are out of touch with this at best, or prejudiced against it at worst, the ensuing loneliness and disconnection can be of a really devastating degree. So the antidote to that disconnection has to have some serious depth and weight. At Plume, our Plume support group program primarily operates in 6-week cohorts. This gives people the time and space to form real relationships that last outside the group. We also form bonds around intentionally empowering and connecting topics. For example, week 4, we talk about trans joy and euphoria, which is not something you often hear about in the mainstream trans discourse. And yeah, it's kind of, I can't speak better than my peers, but it is definitely a core issue in our community.
It's interesting, that reminder about not being seen by experts. Sort of that what you just, one of the main pieces I really am reminded about is the added pain of having that person that you need help from or professional care from, and not being understood or seen, and what a huge impact that can be on somebody's core identity. And that's a wonderful reminder that it's not just a, for those of us who think about providing culturally competent care, it's not just like a nice to do or how to say the right thing or be sensitive, but it really is about seeing someone's core identity, and the opposite of it is devastating versus it being an add-on. So that's really a great reminder. Andre, talk to us about what is this world? What does our audience need to know about the role of loneliness and isolation?
This is where I agree with what Luna and Audrey said, but it takes me back to, I have three sons, and each one has a different personality. And I always tell them, you have to know who you are. And during COVID was when stuff that I knew about them came out, like, introverts, extroverts, and stuff, like being around people. One of my sons loves being around people. Always got to be around people. And when it happened, he's in Atlanta and he's closed in home, and he got depressed, all this other stuff. And I said, you have to learn who you are. Then he takes a job, changed jobs to now working from home. And he moves back to Philadelphia because he wants to be near family. And you can see the transition from all this energy to sitting around the home, sitting around the house, working in what I would say in the dark. We got lights, we got windows, but he's sitting at home working all day. And you can watch this energy dying. And I had to have the conversation. I said, what you never realize is you like to be around people. You get your energy around people. And I said, and so that means you have to know who you are, and one that helps you to figure out what type of job you need. Realize over time that I don't want to work from home. I need to be in a job which I can get dressed and go and work. Me personally, I don't have a problem working from home. I mean, I do have a problem working from home. I don't have a problem being by myself. So you have to know yourself. And that's how I look at it. And that loneliness comes to the energy. What do you get from that? And if you find yourself, because it can do a lot to you if you're lonely. It makes you start psychologically thinking things. And so sometimes you need to get out. That's my logic to it. And I'm not a doctor, medical doctor. Look, I'm not a medical doctor.
You got to know yourself. You got to know yourself. Well, it just makes me think. So all of you who are welcoming people into support groups. So let's get, what is it? So of course, my first thought is, oh my gosh, what are we going to do about all the folks who aren't coming to your groups? But let's first talk about who is coming to your groups, who is reaching out for support, who's accessing your services. What do you see made the difference for them? How'd they get there? How'd they make that call? It's sort of like, how did you reach them? How did it work? Audrey, do you want to start?
Sure thing. So, the community members who engage our programs and resources come from a variety of backgrounds. We engage folks on tribal land. We are in rural areas. We're in urban, suburban, you name it. I said 190 locations and 50 markets. I meant it. With that in mind, when folks first hear about cancer support community, CSC, it's usually by either a member of their healthcare team or actually just word of mouth, right? They've been to a support group, maybe at their local cancer center or at their community-based organization, and now are hearing about these wonderful free resources that CSC offers. I do think it's really important to underscore here that because community is actually in our name, we really do strive to help from outset, from mission to vision, and I can talk about that later, but mission and vision and what we do to ensure that there is that sense of connection, that sense of belonging. I know that our boots on the ground network partners and affiliates are very aware of their areas of opportunity. They recognize that while they would love to be able to be culturally competent in all aspects for all different community members, they may not have the bandwidth or just the subject matter expertise. We're working at the headquarter levels to do qualitative research to address some of these hyperlocal needs to ensure that our network partners are well equipped. But just to summarize, I think there's not one particular person or family member or loved one who comes to CSC. It's a variety of different people of all ages.
But that word of mouth it's still even in this age of social media, probably even more so, right? Just having a friend, someone else give it that thumbs up is probably still such a meaningful part of it. You're there when people need them, that recommendation from healthcare providers, that trusted person, friend, and you're everywhere that people might need them. Luna, how do people, so you started off, you're a health tech company, here now you've run an old school support groups. When Plume started, it was like fancy and, health tech and the cool, right? And now it's like, y'all are doing some stuff that's like, we've known works for a really, really long time. So curious how it's going. So curious how people are responding to it.
Yeah, sure. And I'd like to think we're doing a successful fusion of the two, right? And, using our technology to reach a really broad audience. Plume support groups are attended by people across the country. We're active in most states. I think that's an accurate statement. Across community context, across identity, across generations. Something interesting, Plume has partnered with Northwestern University to conduct a clinical level research study on the efficacy of Plume support groups, and our sample size does not quite reach a stage that would meet the standards for publishing. However, what is already standing out is that participants living in rural communities experience greater degrees of positive outcomes. So that feels really special, and it really tracks with my experience as a facilitator. In the year plus that I facilitated groups, I couldn't tell you how many times I witnessed a trans person speaking to another trans person for the very first time, which is an incredibly moving thing to witness, let alone facilitate and be a part of. But we definitely see people living in adverse or remote communities really benefiting from the opportunity that Plume support groups provide.
And well, I'm just so curious, just to follow up on that. So how, is it something, I'm so struck by all of this. This is this other question I'm gonna ask all of you, in this age of conversations on mental health, and everything's about going to therapy, finding a therapist. I got to find a culturally competent therapist. We all know there's no way that there's going to be enough individual therapists. Never mind that my poor therapists need their own therapists. So there's no way we can have a macro strategy that says, now let's just make 5 million new therapists. So Luna, do you feel like in the groups there are folks that how does it fit into that sort of therapeutic model? I'm curious.
Yeah, that's super interesting. So one of the things I was taught in therapy school is that the actual technique or school of thought of the therapist is significantly less important than the relationship between the patient and the therapist. So the idea that we don't necessarily need that credentialed hierarchical kind of patient-therapist relationship to create therapeutic relationships. We can actually create those with each other in peer support settings, is what I hope to emphasize. I think it has lots of untapped potential in the field of healthcare because our peer facilitators have training and they come in with great skills, but they don't require a 2-year $140,000 degree that bottlenecks people's ability to provide care. So in the active listening skills we train people on, and just creating environments that make it easy for people to access their sort of human innate empathy and relationship building skills, I think has an enormous therapeutic effect that I hope is backed by hard research that people love soon.
Well, I mean, I love, again, this fusion of having a company that's doing both, providing real culturally competent medical care, and then all that wraparound, peer support. I love it. Audrey, talk to us about, who's coming in, how's it working? And that will dovetail into that second question that I have, is like, who are we not reaching? How can we get more people engaged? If you had $1 million, is that the answer? What does it take? Who's coming in, and what does it take to get more accessing all the great care we hear going on this call today?
Yes, I would say Colors has always been more providing a space for youth. I was just ironically writing a grant yesterday, and they asked me what's my demographics, and I'm going through the list. We have about 89% are all 32 and below. That's the majority, but we also have older people to come in, and a lot of time we have homeless come in, needing just to be off the street, safe space, just to get warm, maybe have something to eat, just to feel like just to feel like they are deserving. We get caught up, and I almost said normal. We all are normal. We just have different issues that are going on at the time, and they just want to feel like they can come somewhere and no one judges. One thing you said, we are all, I wish I had all the money in the world to do everything that I need to do. It takes us on a different path to talk about the challenges of nonprofits constantly looking for new funding, looking for grants. I'm writing, like I said, I'm writing a grant now that's due tomorrow. No, due Friday. I got other people writing grants for me. And so it's just good to have a team of individuals who have like-minded providing service so I can sit back and write the grants and run the business of the organization.
It would be nice if the proof was in the pudding. You just had to show that what you do works. And right. And so is it just, for all of you, if my dream is for each of your groups to be full. Like I want thousands and millions and everyone out there to be getting I know what each of you is providing. We're not going to talk about, okay, how do you scale it and get it to 1 million people? But so what's keeping some people from coming in the door? What is it? Audrey talked about his kid's an extrovert. I'm a super extrovert. I'm a joiner. I'm not the person to lead this. What do I need to know about those who aren't accessing your groups?
Great question. For us, we are ever mindful of the digital divide and also concerns about differences in digital literacy levels. And so we do have those network partner locations, brick and mortar that I talked about, but all of our network partners also have Zoom groups and virtual groups for people who would generally engage there, but we have that in-person connection and contact too. Someone made a comment in the chat about immunocompromised folks feeling further disconnected, and I would agree there. When you talk about cancer patients, especially depending on where they are along the care continuum and along their journey, they're really not comfortable coming into a brick and mortar location, but they're more than happy to engage in a Zoom group. We have a lot of our locations set up so that hybrid options are available. If there's a yoga class going on or a yoga group, you can actually Zoom in with your camera and still take the yoga and be a part of the community. To answer more thoroughly your question, though, I think if we had $1 million, if we were able to further engage people, I'm looking at certain states, certain geographic locations where our nonprofits do have private funders and private donors, but often are struggling with the political side of it, right? Wanting to be welcoming, wanting to be publicly affirming, wanting to have a rainbow flag or some sort of small symbol of their allyship and of their willingness to affirm and welcome, but yet have private donors who are very much absolutely not, I will pull my funding. And how do we deal with that? If I had $1 million, we wouldn't worry as much about those bigoted private donors. I will say, and I'm happy to share, that in most of those situations and talking with our network partners and affiliates, they've said, well, if that's your money and your money is tainted that way, we don't want it and we will figure a way out of it. And we're going to go ahead and put this flag on our door anyway. And so, sorry, I feel like I'm getting away from the question. We're ever mindful of the digital divide. We're ever mindful of generational differences of using technology for virtual groups. We have both in-person and virtual opportunities, but we also just have to navigate being able to access funding, as Audrey mentioned, not only from private foundations and also industry partners, but also those private donors as well.
Listen, Audrey, we need to have another one of these conversations about how we signal to each other in inhospitable climates that we are down with each other, right? Like this is how I grew up. I grew up in a small town in Ohio. It was not safe. It's in many parts of where I grow up, it still isn't safe, but we find each other. We've always had the wink and the nod. We have our fun ways of finding each other and staying safe. And I do want, the young people on this call who have not lived through difficult times before to know that we have been here before. We will figure this out. We will figure out how to take care of each other. We will figure out how to stay safe. We will figure out how to switch and move in ways that we need to stay alive through difficult times. So I love what you said about the digital divide, right? So it's sort of like one of those. I love hearing about the Zoom yoga class with folks who are at home and in person. I had a hybrid Zoom class, and we love talking to everybody online. I think it's so beautiful. So I love this idea of thinking about the digital divide. If the millionaires on the call, let's fund, someone gets a cancer diagnosis in this rural area. Let's give them whatever that little hot spot is to go home with that so that we can take care of them. Luna, how could, if you had all the druthers in the world, how would you scale? How would you get more people? I mean, my gosh, you talk about rural, trans folks in rural environments. What do I got to do to reach even more trans folks? Talking about inhospitable states. What could we do? Let's just what could we do to get more people connected with you and your groups who are isolated and alone?
Yeah, for sure. Well, I'll start by not going too blue sky and talk about some of the things we're doing to reach people who currently aren't coming to PSGs in the short term. Uh, in the near future, that looks like standing up more experience-specific Plume support groups. Two that we have that are in the oven right now is GAT, or gender affirming hormone therapy, after 2 years. You know, some people come to our Plume support groups and they feel that it's more of a common space for people who are new to gender affirming hormone therapy, and they're looking for a space for like continuing that journey at a later stage, and looking for peer connection along those lines. We're also looking to stand up. I saw someone mention LGBTQ older adults in the chat. We're looking to stand up a GAT after 40 years of age peer support group. That's something we've got multiple hundred requests for. And we're currently seeking a perfect fit facilitator for that group. So if anyone knows anyone, or if that might be you, the job listing is open. Another big barrier faces politically. In a lot of states, Plume isn't available, and currently Plume support groups are only available where Plume clinical services are legally available. So that's a barrier that we have an active role in the fight for. And we're also brainstorming and looking at different ways to make Plume support groups available outside of the states where we operate clinically.
I don't want to brag, but all of my trans friends are old. So I will introduce you to some of my old trans friends. That sounds, so I love that example. And I know that from Gilda's Club, all the wonderful experience specific support groups, right? Really seeing that particular experience named as a gathering point. It's really, really smart. The way I hear how you really listen to the community, you're really in touch with what's going on and creating new groups. So I just love that. I just thank you, Luna. Thank you, everybody at Plume, for doing that. Great. Oh, good. Yeah. Heavens, hawking jobs. I love
Yeah,
it.
I put
Put
the QR
the
code so
jobs in
people
the
could get in
chat.
touch. Kevin's on top of it. Yeah.
Everybody, if you got a job, you throw it in that chat. I love it. I love it. Andre, I just love what you all are doing. I'm still new to Philadelphia, but of course I've been so familiar with your great impact at Colors. Again, who aren't we reaching? Let's talk about Philly. We've got a new administration here in the city. How can we take this great lesson that you all have learned and multiply it by 10? Who are we not reaching and why?
I would say it's starting. I've learned a lot working with young, vibrant people of color. I have to always step back because, I'm a retired Marine, so I'm in charge. And people tend to think that all the time. And I realized at my age, I'm 60 plus, that if I'm making the decisions on how to provide service to young individuals, then we are failing. So I make it a strong effort to listen to young individuals. You tell me what we need to be doing. And I actually say that. I'm too old to be telling you what I think you want. And so here at Colors, my staff, all my staff are under 30. And they trust me to tell me if I'm saying something and they go, no, I don't think that's right. And will say, no, I think you're wrong. You are wrong. And I listen. And that's the beginnings of growth. You know, whoever you're providing services to, you need to understand that first. If you're providing services to older people, then you want to listen to older people. If you're providing service to younger people, you want to listen to what they are saying. Don't come to me. I'm not the expert. You know, I always tell people, when I was younger, I was the golden child. I can come up with things, but in reality, I'm not that anymore. I need to hear from you. So we have to start there. Understanding the services you're providing, they need to be at the table giving you idea, but you also have to encourage. So if we lived in a perfect world, we'll have all the staff we need, all the money we need to provide the services for everyone, but we don't. And that's the reality. And even if I would hate to have everybody coming to Colors and we don't have the money to provide the services. So my logic has always been, I would use one of the programs. I think you're going to ask me this later, but I'm going to say it now. We have young people who need jobs. And I created a partnership with one of my friends who can get them jobs, you know, working for Amazon, working for, God, I'm blanking, Cash App. And she's like, I can get them jobs. But in our conversation, I said, before I send them out for a job and they get the job, we got to deal with what's going on right now. What's going on right now? They may be homeless. They may have mental challenges that they're dealing with. And we need to deal with that first before I send them out on jobs. So in our designing this program to get them jobs, we came up with, let's do a course on dealing with conflict resolution, how to deal with those. Let's see if you don't have a place to live, let's work on that. You may need your driver's license or your state ID. We got to work on that first. So we created a program called Life on Purpose to start that process. And then they learn how to interview, learn how to write a resume. And we have mock classes where they are learning how to speak to people about a job. That we felt was more important than just send them out for jobs, because that's listening to what they need. So I hope I answered your question.
I love that. Life on Purpose. That is trademark that right now, Audrey. I love it. Audrey, you wanted to add something?
I did, Audrey. I love what you're talking about here in terms of just asking the questions and starting the conversations. I really hope that for the healthcare providers and practitioners who are on this call, they're hearing this, because when we talk about shared decision-making and the shared decision-making model and process, I really do think that improvements can be made, especially in the space of LGBTQ plus healthcare. I think it's not enough to just say, oh yeah, I asked what was on the paper, or I asked some very general questions. You want to have an active listening conversation and approach with patients and their loved ones, right? It's not just the patient in a silo who is along the cancer journey or dealing with other medical challenges or mental illness or whatever sort of, diagnosis we're talking about or disease state. It is the patient, it is their loved ones, it is their own support network and support system. But we can't have these decisions being made. We can't have these recommendations or determinations being made by our healthcare providers and professionals without first asking the patient and their network what they want. What are they not getting? In an ideal world, more of this motivational interviewing, right? In an ideal situation along your journey, what would care look like? What does respectful care look like? What does welcoming and affirming care look like for you in particular? Recognizing that not all trans folks are monolith, right? We're talking about multiple identities here. So Audrey, sorry, got really passionate and excited when I heard you talking about having these conversations with different groups, because it's so important to remember for our healthcare practitioners and providers as well.
You just this note that you are going to end us on, Audrey, about respect. Wonderful, feedback in the chat about really how to take this. What I really hear is about respecting this community care. This isn't a top-down community care model that I've heard from all of you. I'm hearing this really collaborative co-creation, respectful model that really feels, I know all of you are very successful in what you do. And so I hear that coming through so loud and clear. I know that Kevin is going to come back and help us onto our next part, but while he's doing that, any final thoughts as a large group before we break out that anyone would like to share? Don't go away, Kevin. Stay. Okay, so Kevin, I think our next step is that we're going to give the audience time with individuals.
Yes, friends. So you might have noticed the name of this program was Connecting Conversations. And so we've watched these 3 connect, these 4 connect. We'd like to give you all the opportunity to kind of connect with them as well. So if we were in person, there'd be that part where the talk ends and everyone like runs towards the speaker to like get one more question in or make a comment. We're going to simulate that virtually. So in just a second, I'm going to put some links in the chat. And if you click that link, it'll take you to a breakout room with one of our 3 speakers. So we'll go one at a time. Now, of course, if you are finished now, this is your hour, you got to get back to work, that's fine. But if you do have a question, a comment, if you want to connect with one of our speakers, we're going to give you the opportunity to do that now. You'll have to leave the virtual space to do that. So for those of you who will not continue, so lovely to have you here today. We're so honored you joined us. So glad to have our speakers. And for those who'd like to continue, I'm going to drop the first link.